Hello and happy Thursday. It's Rehab Thursdays, as it has been every Thursday, even though you haven't seen me. I wanted to check in with everybody, see how things are going. I have been on a hiatus a little bit. I actually got some messages. Hey, where you been? What's happening? I missed your videos. And I am making a point to make sure that I come on, check in, and keep things brief. So yes. So it's our Rehab Thursdays. Today it has been crazy hot here in Louisiana. I don't know how it's been, how you are, where you are, but it has been crazy hot. Hey everybody checking in. Hi, Dr. Ken, Pamela, aka mother-in-law, Anitra, Mamaw, good to see you too. Glad you're feeling better. So I am going to make this brief. If you're new here, hello and welcome. You are watching Rehab Thursdays. I am your host, Dr. DeJuan Carpenter. I'm a board-certified physical medicine and rehabilitation specialist, speaker, and independent medical examiner. And today, I am actually just doing a little review recap because it's been a while since I've been on here, and it has been a while since I actually even reintroduce myself. So I am a physical medicine and rehabilitation specialist. For many of you out there, if you don't know me, and maybe if you do know me, you may still be saying, what in the world is that? Like, what do you actually do? Are you a physical therapy doctor? Are you a psychiatrist? Because I get that a lot. So physical medicine and rehabilitation is also known as physiatry, not to be confused with psychiatry, or podiatry. We are physiatrists, and I prefer the term rehab doctor because it just is way simpler and easy to say. Hey, Dr. Erica, I see you, girl. Alrighty. Hey, Miss Ethel, glad you could join. So what exactly do we do as rehab doctors? And it's actually very, very broad in terms of what we actually do, because overall it is a specialty that focuses on the muscles, tendons, ligaments, bones, and nervous system, as well as the musculoskeletal system. And the overall focus is basically to help improve patients' function as well as their quality of life. And again, that is very broad. It's not specific. So rehab doctors work in a variety of settings. We can work in the hospital setting. So after you or a patient leaves the main hospital floor, for some places, sometimes it's actually the actual hospital building, then you come to rehab where you're not focused so much on getting well medically, but now you're focused on improving your physical function and improving your quality of life. Sometimes we work in nursing homes or skilled nursing facilities where they have rehab, and again, focusing on increasing the function for those people so that they can return back to their previous living environment. And sometimes we are just seen in the office. A lot of rehab doctors have done additional medical training in which they focus on interventions, such as doing injections to help relieve back pain or neck pain. I happen to be a rehab doctor primarily focused on the in-hospital setting, but I also see patients in a clinic setting where I can focus on other ways to help them increase their function once they are home. I also am an osteopathic physician, And that means that instead of the traditional MD behind my name, I have a DO, which is Doctor of Osteopathic Medicine. And I have one additional tool kind of in my tool bag, if you will, where I can actually use my hands to also diagnose conditions and disease, utilizing the muscles and the tissues that overlie them. So that is the brief, basic run-on of physical medicine and rehab, or rehab doctors. One of the things that comes to mind, particularly as we are seeing across the country that the coronavirus cases are starting to increase, regardless of how you feel about that, whether you feel that the numbers are artificially inflated or don't necessarily believe it or what have you, I can tell you across the country that hospitals are starting to fill up again. What their diagnosis is for most of their patients, that obviously I don't know, but hospitals are starting to fill up again. And particularly ICUs are also starting to become very short on beds. In the rehab side of things, what I have seen in patients that have been affected by coronavirus, and let me also say that it's important, if you have been affected by the coronavirus, one of the big ongoing things is fatigue, and increasing your physical activity on any level after that is going to be vitally important. It's important to kind of slowly increase your physical activity, but you need to do a lot more than essentially what your body really wants to do, because after viruses, a lot of people can definitely relate. If you've ever had the flu, you know that after, a few days of being in the bed, you get up and you just feel so wiped out and so out of it. It's difficult to even do basic stuff, walking from, a chair to the bathroom. You feel tired. That's exactly what a lot of people who particularly have been, most of the ones that I see in the hospital are the people that have a severe case of coronavirus, that have muscle weakness, the muscle aches, that have been on a ventilator. They are typically the ones that I see in the hospital rehab setting, because they have been so deconditioned. Their muscles are so deconditioned from really just, fighting the virus. There are a couple things that just talking to some of my rehab colleagues, we have noticed. One of them is some confusion, altered mental status. The medical term is encephalopathy. This virus has some people only presenting with that particular symptom. The confusion, just not themselves, saying things that don't make sense, not knowing where they are. Now, I am not the CDC. I'm not doing research or anything like that with regards to COVID symptoms, but I'm simply telling you some of the things that I have seen. So if you, or your family member notices these things, it's important for you to go to your doctor and at least get checked out. It's better to be safe than sorry. So that's one of the things that I have noticed. The other thing is definitely that the fatigue that people experience, and this is no matter what age, okay, from 20s to 30s to 60s, the fatigue can be ongoing. And so it is very important to look into getting some rehab on some level, okay? So maybe it's not as bad where you actually need to still remain in a hospital setting like the people that I take care of, but you may need to have some, physical therapy possibly to come to your house. Maybe you need physical therapy or occupational therapy in the outpatient setting where you actually go there a couple times a week to help increase your abilities. But overall, the biggest thing is to make sure that you don't let that part kind of fall by the wayside. There was a recent article, I think it was out of talking about a facility in Chicago, where there was a guy, I want to say he was in his 60s or something, and he had really, really severe symptoms with COVID. He was on a ventilator. He had been in the hospital, I want to say for maybe 30 days or so. And by the time he was recovered, in a sense, where he did not need to stay in the hospital for them to continue to treat him, he says that he literally could barely walk. He could barely do anything. And he really, really found out exactly what rehab was at that point, because it literally, he says, this is not me saying this, that it literally saved his life. And I would say, you know, his quality of life. He didn't realize how much loss of function he actually had to be able to do kind of the regular old everyday things that he was doing before he was affected by the coronavirus. And so, if nothing else, all of the things that have come about with this coronavirus pandemic obviously are terrible. But if nothing else, I hope that people at least understand and get a better appreciation for you know, rehab medicine and what we can do to really help improve people's quality of life. We're not curing anything, although sometimes we find things that there are cures for, and we consult the appropriate doctors for that. But we're not necessarily curing people, but what we are doing is helping them to get their life back, in a sense, that they are able to have that quality of life, to be able to live the life that they want to live kind of on their terms. And that is exactly what I hope people will be able to see from some of what has been going on with the coronavirus as it relates to rehab medicine. Otherwise, I would give everybody the same kind of precautions. When you're out and you can't socially distance, please make sure that you use a mask. The mask helps you not to spread any germs or virus if you happen to be asymptomatic and not affected. But if you just have virus particles, it helps you not to spread it. But also, it does create a barrier if someone else around you is not wearing a mask and happens to be infected and carrying the coronavirus particles as well. Hand hygiene is always and forever will be one of the most important things to prevent the spread of anything, like anything. So continue doing that, and really just pay attention, stay in touch with what is going on around you, especially as it relates to the medical world. Something else that I have seen is that a lot of people are starting to become so paranoid about contracting coronavirus that they are not seeking help for things that they ordinarily would seek help for. So I would definitely encourage people to, just because you are in a healthcare facility, whether that is an office or a hospital, does not mean that you are automatically going to be exposed or contract the coronavirus. Okay. But again, being diligent and, you know, masking up, washing your hands, keeping your distance as much as possible, you know, being smart, using some common sense is always going to be in your best interest. So, hey, Dexter, I actually did not see what's going on with D.L. Hughley. I don't know if he was, I think I saw that he had the virus, but I don't know what happened after that. So feel free to chime in with that because I'd be interested. Hey, Dr. Carla, it's good to see you. So that is my kind of brief recap on rehab medicine, what we do and how we can help you and yours. We are always available. We're always willing to help patients to improve, you know, and get better. So I guess the take home point of the day is no matter what's going on, moving your body is always going to be helpful. It's going to be beneficial in increasing your ability to fight things because it increases your immune system, circulating all of your blood and lymphatic system. That is going to be one of the best things that you can do for your body, as well as protection, like I mentioned already, and keeping up with healthy habits. So definitely you're going to be have a lot more immunity if you're utilizing less sugars and doing fruits and vegetables to kind of keep your immune system up as well. And if you would like more information, I actually posted a video for KDK Holistic Health Coaching that shared some tips on kind of getting moving and some basic simple things that you can do in your everyday. So, you know, some places are, you know, still closing things down and you have limitations on where you can go and what you can do, but you have free reign of your home, and in your home you can make your own gym and make your own activity. So there is no excuse to not continue being active. And if you haven't been active, now is your time. Okay. All right. So guys, you will be seeing more of me. I am committed to reinstituting Rehab Thursdays on a weekly basis. So I can share more tips and tidbits on rehab medicine and how that can help you. So thank you guys so much for tuning in. I think I said hi to everybody that I saw on here. If I missed you, please say hello. I will catch it after the video is over. And if you're watching this on the replay, make sure to type in hashtag replay, just so that I know that you're here and I can send you some love as well. All right, that's it for me on this Rehab Tuesday. I am Dr. DeJuan Carpenter, your board certified physical medicine and rehabilitation specialist, making sure that you stay up, stay healthy, stay moving. All right, I'll catch you guys next time. Bye-bye.